Good afternoon. I am a ratified member of AIOS. I'll be presenting my study on peripapillary retinal nerve fiber layer thickness on OCT in patients with thyroid eye disease. I have no financial disclosure. Thyroid eye disease is an autoimmune condition. Autoantibodies target TSH receptor on thyrocytes, resulting in production of excessive thyroid hormone. Although the thyroid eye disease or Graves' ophthalmopathy, it may also be associated with hypothyroidism or even may be seen in euthyroid Graves' disease. Optic disc dysfunction may be present in patients with thyroid eye disease without any obvious signs of optic neuropathy or extraocular muscle swelling. Traditionally, on follow-up, we assess the visual function of these patients with color vision charts and contrast sensitivity charts. SD-OCT, as we know, is a non-invasive rapid test which performs qualitative and quantitative assessment of retina. There are few studies in literature which have reported reduction in RNFL in patients with thyroid eye disease. However, up to what extent the damage occurs and also in relation to the clinical activity of the disease, this has not been properly established. So with this background, we designed this study to compare the peripapillary RNFL thickness in patients with thyroid eye disease and compared them with healthy controls. Also, we assessed the correlation of RNFL thickness with disease activity. This was a cross-sectional observational study conducted in Oculoplasty department, Sadhguru Chikisalaya Chitrakoot, between September 2017 to February 2018. 44 eyes of cases and 46 eyes of controls were included. All the consecutive patients diagnosed with thyroid eye disease were included. Age and gender matched controls were included. All the patients on which OCT was not possible were excluded from the study. Also, the patients with pre-existing retinal pathology, ocular hypertension and glaucoma were excluded. All patients underwent a complete ophthalmic examination. Clinical activity score was assessed, and SD-OCT was performed with RNFL thickness in all the quadrants as well as mean RNFL thickness being recorded. Data was analyzed using SPSS version 24. These are the results. There were a total of 44 eyes among cases and 46 eyes of 24 controls. Male to female ratio was equal in both the groups, and mean age was similar in both the groups. Mean RFL thickness in among the cases was 97.6, while that in control group was 108. This was highly statistically significant, as well as the RNFL thickness in all the quadrants was also found to be significant. Mean clinical activity score was 2.75, and it had a negative correlation with the disease activity, with coefficient of correlation being minus 0.393. This is a negative slope you can see with the clinical activity score. So in our study, there was a significant thinning of peripapillary RNFL in all the quadrants, and OCT was used for assessment of ONH much before the signs and symptoms of retinal damage occurred in these cases. There are multiple studies which have been reported in literature which have shown that there is a thinning of RNFL in compressive optic neuropathies. So this was however, this study was Mirovich et al. Conducted in patients with thyroid disease. They showed a thickening of RNFL in these patients. Few points to note here are they've used time domain OCT, which might have influenced the results. Also, the study mentioned that apart from the compressive optic neuropathy, as we know, there may be other factors which may be involved, such as inflammation. So they proposed that inflammation plays a major role, which may have resulted in the thickening of RNFL as seen in their study. Fort et al. They found that there's a reduction of RNFL in patients with thyroid eye disease and ocular hypertension, and it was significantly higher in the reduction was higher in inferior and superior quadrants. However, in our study, we found that the RNFL thinning was seen in all the four quadrants. Apart from it, there are very other factors such as endothelin 1. Chu et al. Have reported that the endothelin 1 levels are higher in patients with thyroid eye disease, which may result in ischemic damage causing RNFL thinning. So this was a case report published which showed the potential of RNFL as a prognosticator before taking up surgical decompression. This patient with first patient with decent RNFL before preoperatively developed gain in visual fields post-surgery. This was another patient who had poor RNFL before the surgery, and she did not gain much after the surgery. So this could be another use of RNFL before taking up the surgery. So to conclude, there is a thinning of RNFL in all the quadrants in patients with thyroid eye disease, and it is negatively correlated with disease activity.